Good afternoon everyone, myself Avneet Kaur. I am going to present on synthesis, cyclooxygenase inhibition and docking study of some di and tri-substituted methoxyphenyl benzoxazole derivatives. We know what is inflammation. Inflammation is a complex biological response of a vascular tissue to a harmful stimuli. It is a process by which white blood cells and chemical protect us from the physical damage. Under normal condition, inflammation is limited to the affected tissues, and in severe cases, when the condition becomes uncontrolled, it may result in a cancer as well as asthma. Inflammation is of two types. One is acute inflammation, second is chronic inflammation. Acute inflammation is of shorter duration, and when this inflammation is not treated at the right time, this may result in a chronic inflammation. There are 5 signs of the inflammation, as we know: redness, heat, swelling, tenderness and pain. For the treatment of inflammation, the most common drug which is used is the NSAIDs. These NSAIDs act by inhibition of the enzyme cyclooxygenase. This cyclooxygenase is responsible for production of the prostaglandins. When this NSAIDs will act and inhibit this COX-2, as a result prostaglandin formation will not be there. As in my work, we have synthesized some derivatives. So let us discuss what is the benzoxazole. Benzoxazole is an organic compound having a benzene fused with the oxazole ring, having oxygen and nitrogen atom fused to it. There are 2 types of attack which is possible. One is nucleophilic attack, which is at the 2nd position, and at the 5th position, electrophilic attack takes place. Slight changes in this pattern may result in different pharmacological activities. So, phenoxaprofen and phenoxaprop are the 2 main marketed drugs which are present having this nucleus possessing such type of anti-inflammatory activities. My rationale of work was NSAID act by inhibition of both COX-1 and COX-2. COX-1 exists naturally and it is present in many tissues in maintaining homeostasis, gastric mucosal integrity, etc. Whereas COX-2 is inducible one and is responsible for prostaglandin synthesis. So what is the problem with this drug? The problem is prolonged use of this NSAIDs may cause some side effects, and marketed drug act by inhibiting both COX-2 as well as COX-1. So as a result, the gastric ulceration is the main problem. So our aim here is to synthesize some benzoxazole derivative which can potentially inhibit COX-2 more potentially than the COX-1. My plan of work is as follows. First, we have synthesized some benzoxazole derivatives, and then we have evaluated with the help of the spectral conformation. Then we have gone to the in vitro's activity, COX-1 and COX-2. Then an in vivo activity was performed, and then molecular docking study was done. So these are the 2 series which we have used to prepare our compound. In series 1 we have synthesized 16 derivatives, and in series 2 we have synthesized 14 derivatives. So in all 30 compounds was prepared and evaluated. In the series 1 we have used a tri-substituted compound, whereas in series 1 we have used as the di-substituted compound, whereas in series 2 we have used the tri-substituted compounds. After preparation of this compound, they have undergone to the biological evaluation. Firstly, in vitro activity was performed on both COX-1 and COX-2. In vitro activity was done on the kit obtained from the Camel Chemicals using this following steps. From this, at various concentration, my compound was evaluated, and from that we have calculated the IC50. In vitro activity was done. This is the score obtained from the series 1, and this is the score obtained from the series 2. From the series 1, we have observed that compound 3D, H, K, L and N showed more inhibition than the standard drug for the COX-2. And this is the graph indicating the compound having the IC50 value. Next, for the series 2 also, we have observed that compound 3C, H, M, O, A, B and D and E showed more inhibition than the standard. So from this, we have selected some of our compounds, and to minimize the number of the animals to be used, we have taken some compounds and evaluated for the in vivo ulcerogenic activity. So in vivo activity was performed according to the method of Cioli, in which from the evaluation we have observed that my compound 3D showed the maximum inhibition than the standard. Similarly, from the series 2, having a tri-substituted ring showed more inhibition. The compound 3C showed more inhibition than the standard. So the most potent compound from series 1 was 3D and from series 2 was 3C. This is the representation, the figure of the stomach of the rat treated with the compound, and from this we have calculated our score. This score was given on the basis of the lesions obtained. So at last the in silico study was done, from which we have observed the docking score. The study was performed on the crystal structure of the COX-2 obtained from the PDB bank of the ID PDP5F19. This is the score which is obtained from the series 1, and this is the score obtained from the series 2. And it was observed that compound 3B, 3D and some of the few compounds showed appreciable score than the standard. And similarly it was observed from the series 2. These are the dog pose of the compound which showed more activity, more docking score than the standards. And at last we have concluded on the basis of the structure-activity relationship, from which it was observed that presence of electron withdrawing orthochloro group in the case of di-substituted as well as tri-substituted produce increase in the activity than the standard. And whereas electron withdrawing chloro group at the para position in both these series produces moderate activity, whereas when string was unsubstituted in the case of series 1, that is a di-substituted compound, produced significant activity, whereas from series 2 it showed a decrease in the activity. And further it was observed that presence of methoxy group at the para position of phenyl ring and hydroxy group at methyl at para position produces harmful effect, whereas in the case of series tri-substituted series it was observed that decrease in activity was observed. Similarly, ortho-para substituted chloro nitro group on the phenyl ring lead to increase in activity, whereas in other cases it produces the moderate activity. At last, the compound with the electron withdrawing nitro group at meta position, chloro group at para and meta position produces moderate activity, whereas in the case of tri-substituted it produced decrease in the activity. Conclusion: all the compound was synthesized and evaluated, and it was observed that the resulting docking study found to be concordant with the experimental data, and emerged SAR of the benzoxazole ring plays an imperative role in interacting with the COX-2 active sites. Thank you. At last, I want to acknowledge a sincere thanks to DST Inspire for giving me a fellowship to pursue this work. Thank you.
Thank you, Amit. Now, it's open for discussion. That animal data that you showed, so how did you do that? You cut the skin?
Yes. We have given a drug to the animal, and after 6 hours, we have just we have cut the animal and taken out the stomach. And then we have obtained the lesions which was given, we was calculated the scores accordingly.
Okay, and the docking scores, have you validated the ones which showed the best scores by doing some empty simulations?
Actually, we have done the in vitro study initially, and from that we have selected our compounds. And we were just comparing our wet lab result with the dry lab, so that we can conclude what will be the activity relationship and what will be the most potent compound from that series.
Thank you. Which standard you have used for your in vitro comparison?
Ma'am, we have used celecoxib. Celecoxib as well as ibuprofen for non-selectivity and COX-2 for celecoxib for COX-2 selectivity.
For in vivo studies you have used ibuprofen, right?
Yes, yes, yes. Thank you everyone.